Good morning and welcome back to Inclusivi-TEA podcast. This is episode 7, where we invite you to listen with a cup of tea. I am Leah and I will be co-hosting today with Dana, and our other co-host, Lori, is not with us today. Our guest today is Corey Dion Lewis with the Healthy Project podcast and the My City, My Health Project. Before we get started, we would like to recognize our podcast partners, Black in Iowa News and Alliance for Sustainability. We invite you to follow our partners on Facebook. And if you enjoyed the podcast, please listen, like, and share, and join our Facebook group, Inclusivity Collaborative, where we share more tips on stories in sustainable living. Good morning, Corey. How are you doing today?
I'm doing well. How are you guys? Thank you for having me.
Hey, Corey.
I'm doing pretty good today. I'm excited to talk with you and hear more about the Healthy Project podcast and the My City, My Health Project. So could you tell us a little bit about yourself, Corey?
Yeah, so I am father of two, University of Iowa graduate, um, been in the Des Moines area since 2009. Currently, I am a clinical health coach for our federally qualified health center here in Des Moines, Broadlawns Medical Center, where I help the patients that I serve improve their health through lifestyle management strategies and health education. And like you said, the founder of the Healthy Project, where I kind of do the same thing, but through media.
Can you go a little more in depth about what the Healthy Project podcast is and who you interview and how you come up with your topics?
Yeah, well, with that, I wanna start from the beginning, because the Healthy Project in the beginning, when I started back 2020, was not the Healthy Project that you see today. So when I first started the podcast, it was called Smart Talk, the Smart Talk Health Radio, where I talked about specific, measurable, attainable, realistic, and right on time health and wellness conversations. And I interviewed other health coaches. I interviewed people in health, just health and wellness professions in general, about prevention, just things like that. Like nothing too crazy. It's just a health and wellness conversation about the keto diet, or you know stuff like that. But as the podcast went on, I started having um, this reoccurring conversation around how women of color were treated in healthcare. Started with my mother and how she was treated in healthcare. And then as I would tell that story about how my mother was treated, what I would hear was, you know what, I have a similar experience, or that happened to me. And then I'm like, well, this is different. And I did not want to keep having that kind of fluff conversation when my heart wasn't there. So and around that, it all kind of worked together, because around that time, I was thinking about changing the name of my podcast, because people were getting it confused with an accounting or a finance podcast. They didn't really connect Smart Talk with health. So at that time, it really made sense to not only change the name, but change the topic. And I knew it was going to kind of hurt my numbers, but I didn't really care. I wanted to have a real conversation around community health, social determinants, health disparities, how people are treated in healthcare. And that's where the Healthy Project was born out of that. And still talking about prevention, because that is an important topic to have, especially with people of color and social determinants of health and all of that. But we also talk about, how about health equity, and how research about prevention is not the same for people of color. And there's just a whole wide range of different conversations I'm able to have through the Healthy Project. So now the Healthy Project, we talk about those things. So when I say social determinants, I'm talking about racism in healthcare. I'm talking about health equity and what that means for underserved populations. And I'm having that conversation with these same professionals, but having them talk about it from a Black and brown lens and how we can help that underserved and vulnerable population.
Since you're leading that up, that's one of our questions is, how would you define health equity for our listeners if they're not familiar with that?
Yeah. And what you need to know is health equity, the term is a very broad term. I mean, it can mean so much, but for me, what health equity means is that you feel safe where you live. You, what I like to say, you get that Chick-fil-A service when you go to the hospital, right? And what I mean by that is everybody, there's the stereotype that Chick-fil-A has the best service. You know, when you go there, you're going to get the best service. If they late, you're going to get a discount or a free chicken sandwich. You just know. It's second nature. And when I think about health equity, that's where we need to get to, where second nature, you know, when you step into that hospital, that you're going to get the care you need no matter what color you are. And where you live, you can walk outside and take a walk and not be fearful of taking that walk. So that is health equity. Health equity to me is safety, security, confidence is just second nature.
I love that response. Funny that you mentioned about the safety when you walk. When I talked to a neighbor one time and they were like, "You're leaving, it's only 8 o'clock." And I'm like, "Yeah, it's about to get dark. I need to head home. I know our neighborhood is safe, but I know when it gets dark that it alerts me, like, hurry up and get home." You
Yeah.
got your exercise in. And I think sometimes people who don't look like us do not sometimes understand what that entails. And I've not figured out the best way to explain it other than when situations have happened, like in our daytime,
Mm-hmm.
It brings to mind the gentleman, that was running and he was near the housing development and he got
Yeah.
shot down.
Mount
And if
Auburn. Mm-hmm.
right. And people are like, "What do you mean?" I'm like, "Dude, did you just not see on camera
Right.
that this young man got gunned down and he was running, not running away from something. He was literally out there running and exercising."
Right. Because it's safe for them. So, you know what I mean? So they can't picture that. Prime example, I get up pretty early. I get up at 5 o'clock every morning. And I wanted to start going on a walk in the morning before work. And I walk with a weighted vest.
Huh.
So before I even step foot outside, I have to have a conversation with myself on when I'm walking down these safe streets. Is someone going to think I have a bulletproof vest on, and they don't think I have a bulletproof vest on because I may have a gun, and like I have to go through that
Right.
process, right? So now, just me walking with the weighted vest on for extra resistance for my health, I got to worry about, is someone going to mistake this for something? It don't even look like a bulletproof vest, but
Right.
that's going through my head, and now I got to worry about that. And I got to worry about what time I go out, you know what I mean? And so there's things that they just don't understand because they've been in their safe circle for so long. It's hard to think, it's hard to even imagine.
Right.
I also think sometimes too that our safety, is relative to like the will of the crowd and
Mm-hmm.
and the people that you're around. You can think yourself, that you're safe when you're walking, but let that crowd be different. Let that area you're in be different. Like we can't just we're already weighted when we're walking with
Mm-hmm.
all of these things. We can't just walk and be free. We've got to be thinking also too in terms of being a Black woman. We've got to think in terms of, how how are we being perceived when we're walking alone? And what if we come upon, certain types of people? Like those things are always something that we have to think about. Even if we think the area is safe, just our being there in our Blackness sometimes, uh,
Mhm.
colors that safety.
Yeah, and I find it humorous and sad kind of at the same time is because we're talking about walking, something that's good for your health, something that
Absolutely.
um, reduces your blood pressure, right? And it reduces that stress on the heart. And the whole time I'm walking, I'm so stressed out
Right.
because I got to worry about what somebody's thinking about me, which is defeating the whole point of going on this walk. You know what I mean? So I'm already stressed out and my blood pressure high because if someone's coming my way, now I'm going thinking about should I go to the side? Should I stop walking? Do I say hi? Do it or do I keep it moving? Do it, all these things to make sure that person feels comfortable coming towards me, which is also making me uncomfortable.
That brings me also to what our listeners, if they can't see or know like your height. I know that like my younger brother, he's 6 foot and he's like a big like Rock Johnson size kind of guy. And I always notice that he always tries to make himself appear smaller in certain spaces so that when people come up on him, they don't feel so intimidating. And he would joke when he would come visit and he'll be like, you could just see people kind of like clutching their purse a little bit tighter or this look. And I'm laughing because I'm like, my brother is like the biggest teddy bear you'll ever meet. Not that you should cross him, but I wonder, like when you said like it's that weight, like what Dana said, it's that weight of when we're out and about, how we have to constantly just, be on a swivel all the time.
Mhm.
And you can't even just enjoy the fact you're just trying to go for a walk, something that we know is significantly healthy and it's supposed to reduce our stress, but we're stressed at the same time. Um, I wonder, like, what would you suggest, or I don't even know if you could say suggest, is the goal that you had for the Healthy Project podcast, you said stem from, you mentioned your mom earlier and how
Yeah.
you got started. What are ways other than walking that you may have suggested or how people can have a health? Like I want to go with, you got my city, um,
My
I
city,
can't,
my health.
my city, my health. Your expo you're bringing, is that where our listeners can come and learn more as well as from your podcast?
So they will definitely learn something from the conference. The conference has kind of a different vibe to it. But I'll answer the first question I think you're trying to ask me is, and correct me if I'm wrong, but is it how can people stay active if they don't feel safe being outside?
Yes, thank you.
Um, and what I would say is it's hard because the population that I serve, they can't afford a gym membership. So it'd be easy for me to say, hey, just go to the gym.
Right.
There's a lot of cats out here that can't afford even a $10 membership to Planet Fitness, and all they have is that resource out that they pay taxes for outside their sidewalk,
Right.
right? So, what I would say is it may be uncomfortable, but we got to get past the. I'm speaking for myself because I was that guy that would kind of shrink, and so to make someone feel comfortable or get on my phone and pretend I'm talking to my wife so they can hear that I'm joking about something. And I had to get to the point to where like, no, I'm walking these streets. One, I pay taxes, so I can walk, and you just gonna have to be uncomfortable because I'm not gonna do this with you. And that's just kind of where we have to get to. But also on the flip side of that, as we do that, as we get more confident, um, something I do. I mean, I still stand tall, but I'll smile, I'll say hi to somebody because that's just my nature. I'm not trying to be rude to somebody and me mug them down the sidewalk. That's not the idea. But we got to take control of who we know. We're good people. They just got to deal with that's their fear, not mine. So we got to get to that point to where we can comfortably walk on our sidewalks, utilize the parks. The parks are great places to get exercise as well. And some of these parks have kind of like exercise equipment in them. I know there's one on Franklin Avenue. If you listeners are in the Des Moines area, they're right by the Franklin Library. There's a park where they have like an elliptical machine and like pull-up bars and things like that at the park. So utilizing your local high school if the track is open to the public. You know what I mean? I know those are great ways to be outside too, but also use your sidewalk. Like walk where you at. You can do that.
I know that's right. I know that
Yeah.
is right.
And so, to answer the other question about the conference, so the conference has evolved from the moment, and I know Dana, you've been involved in that from the beginning. And from that moment that I've had that conversation about I'm doing this conference for the community, the community has spoken and said we want to be involved. And it's just been a blessing to go through this process. So with the conference, the My City, My Health conference, the theme this year is health is a community effort. And where I came up with that idea for the theme has been based off of my experience working at Broadlawns and having situations where I may be speaking with someone with diabetes and they're so concerned about how they're going to make rent that they're not focused on how they can improve their health. So reaching out to community-based organizations to help them with some resources so they can focus on their health. And that's kind of where it started. That was kind of the genesis of the idea. And now it has expanded to 4 separate panels, a panel on racism in healthcare, a panel on community collaboration in healthcare, a panel on mental health, and a panel on prevention, where we're talking about these things, but not only for the healthcare professional, but for the people in the community who, one, want to learn more about the people that are providing the service and what they think, but also to give their 2 cents on how racism has affected their healthcare, has affected them as a healthcare consumer. We have a lot of people who have gone to the hospital once, treated poorly, and they will never go back again. And
how will they be putting in their 2 cents during the conference?
so a lot of it will be through questions to the panelists. There will be networking times where they can connect with people there. And just having that, I think there's great value in being able to walk up to the chief medical officer of Broadlawns Medical Center and say, hey, this, or even a doctor or a social worker, say, this was my experience. And that person can take that information back and maybe change how they do things, and how they work with patients.
I wanted to make sure we are clear. Your how to find you on the Healthy Project podcast, and then the second is, when is your expo and how do people go in? Was it going to be like a RSVP or forgot how you? It has been so long when I asked to be a part of a expo, but how do people come and learn more, and how do they join?
Yeah, so if you want to learn more about the podcast is available on all major podcasting platforms. So Spotify, Apple, Google, Audible. You can go to the website, thehealthyproject.co. You can find them all there. To learn more about the conference and to be involved, you can go to mycity.health. You can learn more about what it's about, who's currently on the panels. That is evolving as it goes forward, but so far there's the people that are there are a part of it. And also there's a link to register for the in-person, and then the virtual platform will be up shortly if you want to catch it virtually.
Tell us
Okay.
again, what date is the
Yes,
conference?
November 11th at Mainframe Studios. So it's a one-day conference from 8 to 5, and then we'll have some networking stuff afterward. My cousin, who's a award-winning poet, she'll be providing the entertainment for the lunch hour. We're going to have some. It's just going to be a vibe. Black and Bold Coffee is sponsoring the coffee for the morning. It's just going to be a great time, a great value, and that's what I'm excited about. It's not like a conference where you're just sitting there and you're waiting to leave. You're going to sit there and you're going to be excited to be there, and you're going to learn a lot, and you're going to have a lot of fun.
So Corey, we're gonna get close to wrapping up. Unless Dana, did you have any more questions for Corey?
I just wanted to know kind of what's the main key takeaway that you want people to get from the conference? What do you want them to go home with?
What I want people to understand is that the healthcare does not stop or start at the hospital. It takes, again, it is a community effort. And the more we understand that as a population, and the more people understand what's out there, hopefully we can take a step forward in improving the health of the people in our communities, specifically our underserved Black and Brown communities, where we're utilizing the services that we need, and we can just improve the health of everyone that we can touch.
So Corey, what is the one message that you want us contemplating? Like, what is your one quote for yourself, or what is one message that you live or stand by?
So, and this is fresh in my mind. And this wasn't anything that I came up with, but it's had me thinking, and it had about my everyday, and it's around preventative care. Preventative care is one of those things where it's like we've been talking about going on a walk, or making healthier choices. And I was speaking with a podcast guest. The podcast hasn't came out yet, but when it does, it's going to be a great one. And he said something to the effect of, every decision you make for your health shortens or widens your world. As we get older, the decisions we make now, and he gave the example of a woman who didn't walk, or they weren't mindful of their physical activity, they weren't mindful of their nutrition, and now the only exercise they get is just walking laps around their house, around their living room, because their world has shrunk that small because of the preventative measures they didn't take. So the one question I would leave with you guys and your audience is, what are the things that you're doing to widen your world, to expand your world, or to shorten your world? Because you may not want that apple, because that whatever food sounds, or that cake sounds better, but is that going to shorten your world? That walk doesn't sound very pleasing right now, but is that going to shorten your world? And because we're all getting older, and at some point, there are people well into their 80s that are very active, and their world is wide. But there are a lot of people we know that won't leave the recliner because they can't.
Mm-hmm.
They physically can't. So what are you being mindful of today that's going to affect how you live your life tomorrow?
What you are being mindful of today is what's going to affect your tomorrow. I can dig that. I wanted to tell you, thank you, Corey, for coming today, and thanking our listeners for being here on our Inclusivity podcast. You can listen on YouTube, Anchor, and other popular podcast sites. Please tune in next week when we'll be talking with Mandy Nichols, Chair of Iowa City Community Police Review Board. And again, thank you to our podcast partners, Alliance for Sustainability and Black Iowa News. And thank you, Corey Dion Lewis, founder of both the Healthy Project podcast and the My City, My Health conference. I hope you will come back and talk to us closer to the conference date of November 11th. Thank you.
Yes, absolutely. Thank you.
Thanks, Corey.